All right, here we go real quick. Remember, the intent of the car rant is to maintain my own therapeutic focus so I don't lose my mind. Because here we heard it again today. 174 people dead. CDC out with another report. 174 people dead per day. Kills more people than breast cancer. Number one killer of people under the age of 50. All that stuff, right? Driving down the life expectancy. Absolutely stunning. And we see all these reports and things like that. And I saw it all kinds of different places. My man Ryan Hampton, shout out to Ryan Hampton, he posted it. He used the word outraged, and we need to be outraged. The Addiction Policy Forum, shout out to the Addiction Policy Forum. They sent it to me. They are outraged. But here's the thing. Yeah, we're outraged. But as recovery advocates, when are we going to take our outrage and actually put it into motion? Because here's the thing, do you understand, we're not making an impact in any kind of way. Nobody's really changing anything. And here's what I think it's because we're too damn nice. I still think that we want to be, we want to be the cool kids. We want to be sitting at the cool kid lunch table and invited to all the conferences and, speak at all the events and put on the governor's panel and this and that. And so we don't really say what we think. Well, for one, we're pretty damn well funded here at Favor Greenville. We're pretty good to go. We are an independent organization. We got no strings attached. I'm going to tell you right now, I think it's completely screwed. I think you need to bring a bulldozer in or dynamite or something, blow up this whole damn system and start all over. I think it's completely sickening that 174 people a day die. And what's even more sickening is that our response is to have another committee meeting. I think it's really, really troubling that the private treatment industry that's funded by healthcare insurance companies, I think it's so troubling that the overwhelming majority prescribe one-size-fits-all treatment. And that many, many reject MAT, medication-assisted treatment, out of hand from a philosophical standpoint. That they run their treatment centers on their experience, strength, and hope. It's your treatment center. It's not your home group. And they get away with it because our regulators and our insurance companies they couldn't care less about addicts and alcoholics. They really don't. There's no sense of urgency whatsoever. Ironically, I think our publicly funded systems are more willing to use evidence-based practices. They're less well-funded, but they're more willing to use evidence-based practices. I'll tell you that right now, and that's good. That's good. But overall, man, we need to tear this thing down and start over. And I'll tell you what, we need a Department of Recovery. We need a czar of recovery. We don't need to roll it through the existing infrastructure. But here's the problem. Understand that the existing system, the whole system, it exists to promote itself. One last thing. It drives me crazy that we allow organizations like NATAP, the National Association of Addiction Treatment Providers, to speak for us and to co-opt the word recovery. There should be no conversation that doesn't include real recovery advocates. And you cannot be a recovery advocate if you work for a treatment center. You have strings attached. By definition, you're not independent. You don't represent recovery. You represent treatment. They are two different things. Treatment, at best, is the initiation of recovery. Recovery is a lifelong process that needs to be driven by recovery advocates. And recovery advocates, it's time for us to get a little courage and get a little aggressive and call it like it is. Again, Favor Greenville, I'm so grateful because we have very, very smart people, business leaders in the community, philanthropists who have backed us and are going to continue to back us, and they support us. And you want to know why they support us? Because we don't try to sell that bullshit company line that's out there. Many of them have had their own personal experience. They've sent people off to the bullshit company line, and they see it for what it is. And I just started saying it out loud, and people were like, amen, that makes sense over there. What that guy over there is saying, he didn't say what those 99 people over here said. He said something different. But you ain't seen nothing yet. I'm so freaking fired up. Here's a couple other things. I want to talk about the solution. Department of Recovery has nothing to do with the existing infrastructure. Return treatment to healthcare. Make it primarily a healthcare issue. You need about half the number of rehabs that currently exist. Most of them are ineffective, and they're really just kind of taking up space. 50% reduction in rehab beds, but a 50% increase in detox beds. Shorter term stays, all treatment local, so that they can integrate with their lifelong recovery community. Destination rehab is absolutely unnecessary. Beautiful facilities nestled in the mountains or on the beach. That's really where they always are, on the beach, right? You're going to be doing yoga on the beach. They're really not necessary. Keep a couple of the really good ones because I guess in certain circumstances you're still going to need them. But for the most part, make everything local. Provide health coaching, recovery coaching, independent recovery organizations, not part of the larger system. What do I mean by independent? No strings attached. They're not attached to a treatment center and they're not attached to government dollars. They're independently run so they can do exactly what they need to do in every single circumstance. That type of structural change, that stuff will give us a fighting chance. And I actually think it can happen. And the last thing, Favor Greenville, we've also been selected as one of 4 model programs across the nation. And the reason I say that is I want to let you know that we're not crazy. People agree with us, guys. There's a growing national movement, and there are folks ahead of us in that process. And, we're not the only people in this deal, is what I'm saying. And I struggle with the advocates who won't speak out. I struggle with the ones that are so connected to the existing infrastructure that they won't say anything. But there are many of us that will. I look forward to 2018. I'm glad to be part of this process. And Favor Greenville, we intend to lead this process as much as possible. And we have some affiliations, we have some national relationships that we hope explode. And you're going to hear us. And we're not going to talk in politically correct terms. We're going to call it like it is. We're going to talk about the elephant in the room. It's like you're at Christmas dinner and Uncle Joe is passed out in the mashed potatoes, right? Nobody will say anything about Uncle Joe passed out in the mashed potatoes. Well, I'm going to be the dude in the room saying, Uncle Joe's hammered again. Here's the deal. The treatment system's broken again. The industrial addiction treatment system complex is not working. But I love all the people who work in it. You can do that. You can love the people, hate the system. Love the people, hate the system. Love the people, hate the system. All right. Later.